Hello, my name is Aranza Triago, and I'm going to talk about narrating insights into fibrosis. Definition is a development of excess fibrous connective tissue in an organ or tissue as a consequence of a reparative or reactive process.
Fibrosis, cystic, one of the most common grave genetic inherited diseases. CF affects the exocrine glands and is characterized by the production of abnormal secretions, leading to mucus buildup. This accumulation of mucus can impair the pancreas and, secondarily, the intestine. Mucus buildup in lungs tends progressively to impair respiration. Without treatment, CF results in death for 95% of affected children before age 5. However, with diligent medical care, patients with CF are surviving even beyond middle age. Early diagnosis of CF is of great importance. Early and continuing treatment of CF is essential for long-term survival. However, as more people with CF survive childhood, new problems are emerging. For example, 68% of 75 adult women with CF reported leakage of urine within the past year. Coughing, sneezing, laughing, and airway clearance provoked the leakage, which was worse when their chest disease was most severe. CF is inherited in an autosomal recessive manner and affects both boys and girls. 1 in 400 white couples is at risk for having children with CF, and their risk with each pregnancy is 1 in 4, so multiplying 1 in 400 times 1 in 4, the overall risk that their child will have CF is 1 in 1600. Note that once a couple has had a CF.
Applications in medicine is present in pathology such as cystic fibrosis of the pancreas and lungs, endomyocardial fibrosis, idiopathic cardiomyopathy, cirrhosis, idiopathic pulmonary fibrosis of the lung, mediastinal fibrosis, proliferative fibrosis, tuberculosis. Pros and cons. Pros. It doesn't have cons. Dyspnea. Limitations and movement with loss of elasticity. Accumulation of fluid in the abdomen. As it is. Issue point in Ecuador. Official figures tell us about one fibrosis patient per 11 to 50 inhabitants or healthy newborns classified as a rare disease. Cystic fibrosis affects 1 in 5,000 babies according to the World Health Organization. It is a genetic incurable.
Hey guys, I am Mary Fry. I was diagnosed with cystic fibrosis when I was 7 weeks old. So now that I've lived with the disease for 26 years, I call myself a professional patient. But maybe you're here because you have a family member who's recently been diagnosed with cystic fibrosis, or maybe you read about it in a textbook and you want to know more. Maybe you have a coworker with it or a student in your classroom. Let's talk about what is cystic fibrosis. By definition, cystic fibrosis is a life-threatening genetic disease that causes persistent lung infections and progressively limits the ability to breathe. But beyond that definition, cystic fibrosis affects so many different parts of the body, and I think it's really important to point out that cystic fibrosis, or CF for short, looks different in every single patient. There are so many mutations of CF, and every single CF patient prefers to be called something different. Some people like to be called CFers. Some people like to call themselves cystics. I don't know if that's actually true, but I heard that once. Some people like to refer to themselves as cystas or fibros. There are so many different terms. I call myself a CF patient usually, but some people don't even identify themselves as a patient, and they like to keep it on the down low. And that's fine too. Cystic fibrosis is a genetic disease, so my parents are carriers of the gene, but they didn't know that it ran in our family until my sister was born. And it turns out my sister and I are the only two people in our family with cystic fibrosis. So CF at a cellular level affects every single cell in our body, but mainly symptomatically we see lungs affected because our lungs have too much mucus in it, which is a great place for bacteria to grow. So that means our lungs are constantly fighting bacterial infections. Daily therapy is super important to help keep our lungs as healthy as possible. The therapy we do is called airway clearance, and it's to do exactly that. Hope to clear our airways of some of that thick, sticky mucus that is in our lungs. So many people use what's called the vest. It's a shaking machine that literally helps to shake the mucus out of the lungs. You can also use exercise as a form of airway clearance, jumping on a trampoline, dancing. You can do like just about anything to help clear your airways. It is vitally important that CF patients are diligent with these airway clearance treatments because unfortunately we can't just put a pause on our lung deterioration or the mucus buildup. It happens whether we want it to or not. But we can do our part in trying to keep our lungs as healthy and clear as possible.
Conclusion. Fibrosis is not a disease that can occur in isolation, but is a sign that occurs as a consequence of many different diseases. It is possible to develop fibrosis of the lungs, liver, kidney, heart, or skin.